Welcome to Linnea's webinar on COVID-19. This is my YouTube debut. Someday when I have my own channel and 1 million subscribers, you can brag that you saw my first video. Seriously, we are all navigating new territory since the onslaught of COVID-19. And I decided to speak today in order to shed some light on a topic that is seldom mentioned in the popular press. My goal is to demystify the question we are all afraid to ask. What do I do if I get COVID-19? To start off, my credentials. My name is Linnea Ritter, and I have been a family and geriatric nurse practitioner since 2001. And I've been working in healthcare since 1982, starting out as a candy striper and nursing assistant. Currently, I work for Marathon Health, which is a company based in Vermont that provides on-site healthcare in the workplace. I made a career change to this employee wellness field, and I really love the preventative care approach. To be honest, in my 30-year career, I have never experienced a pandemic to date. Objectives are listed here. My goal with this presentation is to tailor the vast sea of information into clear evidence-based practical tips for negotiating what to do if you get COVID-19. Remember, the best sources of information are the Centers for Disease Control website and the State of Minnesota Department of Health websites. There are 21 slides, and this presentation is less than 18 minutes. What is needed for a pandemic? Why are we making such a big deal about COVID-19? Bear with me as I talk a little bit about what a pandemic is. First of all, it must be a novel or new organism. There has to be little or no immunity in the population. It has to be able to replicate in humans and be potentially fatal, and more than a mild upper respiratory symptoms. It has to have the ability to pass efficiently from person to person, and generally droplet transmission is the most efficient. Until we get a vaccine, we will be dealing with this pandemic, and that looks to be about a year away. The coronavirus is a large family of viruses. They're common in many people and different species of animals. It is zoonotic, which means it's found in both animals and humans. It is often abbreviated SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. The 19 simply speaks for the year it was discovered. How does it spread? It's mainly from person to person through close contact. When one infected person coughs and another person can breathe in those droplets into their lungs. It can also be picked up on contaminated hands, clothing, and surfaces. How contagious is COVID-19? Most diseases are assigned a NOT score, and this basically explains how many persons one contagious person will infect on average. This illustration really demonstrates why immunizations for everyone in the population is so important. Each dot represents a NOT of 1. If the NOT score is less than 1, the disease declines and eventually dies out. For example, the MERS-CoV virus in 2012 was limited to 27 countries. It had a very high fatality rate of about 37%, but its NOT score was around 1. The SARS-CoV virus in 2002 to 2003 was limited to 7 countries. Its fatality rate was about 10%, but its NOT score had a median of about 0.49. These two illnesses were largely eradicated by intensive contact tracing and case isolation. Take a look at this illustration. Look at measles and whooping cough. They have a NOT score between 12 and 18. This speaks to why we need immunizations for these contagious diseases. The NOT score for COVID-19 went from 2.3 to 14 as of April 2020. Prevention. I'm speaking to the choir here. We have all heard this information, but the basics are still the best way to prevent spread. I have been walking into rooms with sick people my entire career, and I rarely get sick at work. The reason is I follow these preventative recommendations, and we use universal precautions to protect ourselves. This slide illustrates the rationale for stay-at-home orders. Flattening the curve simply extends out the peak incidence of cases. Long-term, this practice does not reduce the number of infections, but it simply buys time for the healthcare facilities to, number one, get personal protective equipment, number two, create the infrastructure for widespread testing, and number three, prepare the hospitals to care for the sickest persons. There's a 10 times greater survival rate if the sickest persons are cared for in an ICU setting. Thus, we do not want the ICUs to be overrun. Governor Tim Walz closed Minnesota between March 25th and May 13th, and this definitely flattened the curve for Minnesota. The truth is, 80% of the population will need immunity before we can go back to normal. COVID-19, the basics. Let's cover these. It is potentially serious. However, the majority of persons will only experience minor symptoms that can be managed at home. And by staying at home, we can stop the spread and protect the persons at risk. 80% will have mild symptoms up to a mild pneumonia. 14% will have severe symptoms that require hospitalization. This will generally be older adults or persons with medical conditions like lung disease, heart disease, cancer, diabetes, immune disorders. These persons are at the highest risk for contracting COVID-19. 5% will have critical illness and require an ICU level of care. The pandemic in 1917 was different in that it attacked those persons with intact immune systems. My grandmother's brother, who was 16, died in that pandemic. Each pandemic has a different population demographic that it can be most deadly for. The symptoms of COVID-19 initially were simply fever, cough, and shortness of breath. Now it has expanded to almost every body system, including nausea, vomiting, muscle pain, headache, sore throat. Lots of folks are mentioning that they have a loss of taste or smell. These symptoms will appear anywhere from 2 to 14 days after exposure, and the average incubation period is 5 days. This makes it difficult to control because often people are contagious long before they have symptoms. Testing sites in Minnesota can easily be accessed by going to the Minnesota Department of Health website, entering your location via zip code, and the tool will give you the address and contact information for your closest testing site. This is significantly improved over the last couple of months. The best way to get in line for a test would be to call the triage line and then be accessing the drive-up facilities. Unfortunately, testing has been taking long periods for results to come in. I've heard of some people having to wait a week. Okay, time for Nursing 101, my favorite part of this presentation. As a caregiver, what information do you need to know about your patient? What supplies do you need? Do you know how to measure vital signs? Temperature, pulse, respiratory rate, blood pressure? Maybe watch a YouTube video to educate yourself. Are you aware of your patient's health history? What medications they take? Do they have any allergies? My recommendation is to have a notepad handy and write down dates and times of what you are observing and monitoring. For example, what are their vital signs? Intake, output, sleep, energy level, cough, comfort level. Be prepared with this information if you need to call your healthcare provider. As a caregiver, you want to protect yourself from contracting COVID-19, and you're definitely more at risk by being in close contact with someone who has it. Wear a face mask, separate outfits and gloves when caring for that person. Every day, clean the surfaces in the room where the person is staying. Wear gloves when handling soiled items or wash hands immediately after. Use hot water when doing the laundry. Avoid unnecessary visitors and do not take trips to the store or outside the home unless absolutely necessary. Dispose of the trash on a daily basis. For the ill person, stay in one room or using a separate bathroom if possible. Avoid sharing household items with others. Wear a mask, wash hands. Avoid touching eyes, nose, and mouth, and use tissues for secretions and dispose of in a lined garbage can yourself. If you're using a nebulizer, if you have asthma or some other condition that requires albuterol, use near an open window or a well-ventilated area. Anecdotally, want to share that albuterol is not helpful in the treatment of COVID-19. Care for a fever. Recommend treating any fever over 101 degrees or if the person is reporting discomfort. Both Tylenol and ibuprofen can be used for treating fever and base the dose on the child's weight or the adult dosage on the package. Rectal temperature is the most accurate. Oral temperatures are close second. Axillary temperatures are generally 1 degree less than the oral or rectal. Whatever method you use, be consistent with it. The infrared measurements are not as accurate, but are great for screening. Other treatments for fever: cool compresses, a wash rag with cool water, an ice pack, lukewarm sponge bath, and then allow evaporation. Avoid too many blankets, turn down the thermostat, turn up the air conditioning. Cool fluids such as popsicles, ice chips, ice cream, fruit smoothies. Do not use rubbing alcohol. Monitoring for emergency signs. Most concerning would be trouble breathing, the inability to finish the sentence. Ask an open-ended question to determine if the person can finish the sentence without having to stop and breathe. For example, tell me about your breathing and activity level today compared to yesterday. What is their rate of respiration? Normally, it should be somewhere between 12 and 22. Are they using their intercostal muscles to breathe? Are they confused or seem unable to arouse, very sleepy? Is there bluish lip or paleness to their face? Is there fever over 102 degrees? This list is not inclusive. Consult your medical provider for any other symptoms that are severe or concerning. Caring for a cough. Cough is very common with COVID-19, and for the folks that I've spoken to who have had it, they describe it generally as being a dry cough. Overall, coughing is a healthy way for the lungs to clear out and expand, so it should not be eliminated entirely, but just enough to rest and be comfortable. To control the cough, when you need to rest, I recommend a cough suppressant such as dextromethorphan. If you need to help expectorate or get the mucus out, use guanfacine. Both of these cough syrups can safely be combined with Tylenol or ibuprofen. And if you use an albuterol inhaler, you can continue to use it during your illness. Anecdotally, it also has been noted that the prone position is better for breathing with COVID infection. Prone meaning lying on your stomach. Other common remedies, hydration. Cannot stress enough that you need to drink a great deal of fluid as you're losing a lot of moisture through your respiration and fever. Foods. Nutritious foods should be offered frequently, small amounts. Comfort foods generally go over best, but are very important for energy while trying to fight an infection. The immune system needs fuel. Activity level. Encourage rest, but also encourage activity, just moving about and stretching a couple of times a day at least. Go outside and get some fresh air. For personal care, it is mandatory that they take a bath every day, brush their teeth twice a day. Bedding, if it has gotten wet from sweat, should be changed, and clothing should be changed also on a daily basis. Your patient might resist on this, and this is where you need to stand firm because they're going to feel better once they complete these activities. When to end home isolation? The CDC has given us some guidance on this. There has to have been no fever for at least 3 days, 72 hours, and that has to be without the use of medications that reduce fever. Number 2, the symptoms have to have improved, and it has to have been at least 7 days since the first symptoms appeared. And thirdly, they'd recommend that you consult your healthcare provider. I hope this information has been helpful and that your anxiety regarding contracting COVID-19 is decreased. Let me know in the comments if there are any other topics you would be interested in learning more about in the future. I wish you well. Have a good day.